So I'll be talking about the epidemiology of non-fatal drowning in Canada, and particularly how it varies from fatal drowning. The epidemiology of fatal drowning worldwide, and particularly in high-income countries, has been fairly well described. In Canada, certainly, we have quite a good grasp on our drowning mortality, and have sort of over 20 years of data that we can look at with regards to fatal drownings. But much less is known about the scope of the non-fatal drowning problem, and we've mentioned that quite a few times during this conference already. In 2013, at the World Conference in Potsdam, I presented a literature review that I had done on non-fatal drowning. And in that exercise, I had collected all of the estimates of fatal to non-fatal drowning that I could find in the literature, regardless of the study type, study design, or whether it was just somebody's random estimate that they were able to publish. And I found a huge variety, from 1 to 1, basically, to 1 to 50, meaning that they were estimating that non-fatal drowning was 50 times as common as fatal drowning. So I became very interested in examining this a little more, and I left Potsdam saying I was going to find out about non-fatal drowning. And so now in 2016, I've just started figuring something out. And very happy to talk about that today. So non-fatal drowning contributes substantially to the economic burden of injuries. In Canada, the total cost of drowning in 2010 was $187 million. So that's including non-fatal drowning. That's for 1 year. And a study by the CDC found that 50% of non-fatal drowning patients require hospitalization or transfer for more specialized care. And that's a lot more than what's typical for all unintentional injuries, which is usually around 5%. So definitely a large burden from non-fatal drowning has been reported in the past. And of course, we know that there are significant consequences to non-fatal drowning in terms of morbidity. Most existing epidemiological studies of drowning have focused on fatalities only, as I've said. And there's a lack of information in terms of the risk factors and characteristics of non-fatal drowning. There are some existing non-fatal drowning studies, some of which have been conducted by people in this room, but they often are limited in terms of the population. So either they might include children and adolescents only, might not include water transport incidents. And in Canada especially, these are very important groups in terms of our fatal drowning problem. So we were really interested to know if our non-fatal patterns sort of match that or not. So in Canada, we have very high rates of drowning among seniors over 65 years of age, especially in recent years. And about 30% of our fatal drownings are the result of water transport. So interested in finding out about non-fatal drowning in these areas. In the studies that have been conducted in non-fatal drowning, there has been some indication that the characteristics may differ between non-fatal drowning incidents and fatal ones. So with all of that in mind, the purpose of the study was twofold. The primary objective was to sort of bring to light the burden of non-fatal drowning in Canada, bring some more attention to it because we've been mostly focusing on fatal. And a secondary objective was to identify which characteristics, if any, differ significantly between fatal and non-fatal drowning incidents. So this was a retrospective study looking at 5 years of drowning data. These are from fiscal years 2008 to 2009 to 2012, 2013. Generally speaking, non-fatal drowning patients who required ambulatory care or who were discharged by an acute care facility, so we're looking at both emergency departments and hospital admissions, were compared to unintentional fatal drowning cases. More specifically, for the fatal drowning data collection, the data was obtained from the Drowning Prevention Research Center. I've detailed that process in other presentations, and it's also published, but I can just sort of briefly tell you that this is an annual ongoing project where trained local data collectors enter the coroner's offices in each province and territory in Canada. They collect data on all of the drowning cases using a structured questionnaire. These questionnaires are returned to national project managers that verify the data and enter it with appropriate data quality control. So we have a very robust fatal drowning data set in Canada that is total population for unintentional fatal drownings. For the non-fatal data collection, the Canadian Institute for Health Information maintains a number of databases, and 2 of these were accessed. So this is a map of Canada. These are the provinces and territories. And unfortunately for the non-fatal data, it was not available for every province and territory as it is for the fatal data. So 2 databases in particular were used. One is called the Discharge Abstract Database, and this is for the hospital admissions. So this is maintained by CIHI, and the acute care facilities have their health professionals fill out abstracts which are provided by CIHI, and these would include demographic, clinical, and administrative information, and they're sent back to CIHI either directly by the facility or by the respective health administration unit. So this data is available for all provinces and territories in Canada except for Quebec. So we had quite a large sample in terms of the hospital admissions data. For ambulatory care, and so emergency departments, some day surgery clinics, things like that, it was only available for 2 provinces, Ontario, which is the most populous province, so it was still a very large sample, and Alberta. But for Alberta, it was only available for the most recent 3 years of the study. So they only started collecting this data partway through our study period. So for the fatal drowning, we have a total population. For the non-fatal, we have bits and pieces, but it's definitely a good start and better than nothing. So the outcome variable in this study is drowning, fatal or non-fatal, based on the internationally accepted definition. And for the CIHI data, this was identified by the relevant ICD-10 codes. We include water transport, as I said. So we included the V90 to V94 codes, except for the ones that specify that it was not drowning or submersion, which is V91 and V93. Then your regular or generally accepted and included drowning codes, which are W65 through W74. And we also included the intentional codes for the univariate analysis to describe non-fatal drowning. We do not have currently intentional fatal drowning data. It's not collected at this time by the Drowning Prevention Research Center. So we could only do the sort of univariate on the non-fatal, and then we excluded those for the comparison. So for the 3 databases, the NACRS is the emergency department. So that's Ontario and 3 years worth of Alberta. We extracted 8,115 cases. For the Discharge Abstract Database, which is the hospital admissions for all of Canada excluding Quebec, there was 1,838 cases. And then for the fatal cases from the DPRC database, there were 2,283 cases. As I said, we conducted univariate analysis to report descriptive statistics on the total sample, and then excluded some cases for the bivariate and multivariable analysis. So from the NACRS database, we excluded patients that died, because those are already reflected in the DPRC data, and patients that were admitted to an acute care facility, because those are already reflected in the Discharge Abstract database. For the Discharge Abstract database, we then excluded patients who died, again, because they're reflected in the final group. And for the DPRC data, we excluded Quebec because they're not reflected in the other databases. So a little bit of figuring things out with the data set. So some results. In terms of the emergency department visits, so non-fatal drowning patients who required a visit to an ED or a day surgery or a clinic, but did not need to be admitted to hospital. This is the age and sex profile. So the age breakdown is quite different than what we see for fatal drownings. It's much lower for the older group than what we see for fatalities, which is probably expected by a lot of people. And there were more males, as usual, than females. About 2/3 were male and 1/3 female. In terms of external cause, overwhelmingly, the greatest proportion came from water transport incidents. So this tells me that we may need to go back and look a little closer at the V94 water transport incidents that we included and ensure that they are all drowning. So we looked at the other codes to sort of exclude ones that were most likely not water-related, but perhaps we've been a little too inclusive looking at the size of that category. But even if we exclude V94 altogether, the majority of the incidents will still come from water transport from V90 and V92, which specify drowning and submersion in the code, so those would definitely be included. Some other interesting information, 83% were discharged home directly from the ambulatory services, 11% were admitted to hospital, and 2% died on or after arrival. For the hospital admissions, you can see the age and sex breakdown there. Sex was almost the same as for the emergency department. The age is a little bit different. We're seeing some more younger children being actually admitted to hospital, a greater proportion. And the breakdown of external cause is quite similar, with, again, water transport being the largest, but not quite as much as what we saw in emergency department. In terms of the comparison, it's a little bit of an unusual approach that we took because the purpose of the study was to identify the characteristics of non-fatal drowning. So it seems kind of strange because normally you would be talking about survival rates or the relative risk of dying. In this case, we're reporting the odds of being a non-fatal drowning victim as opposed to a fatal one. So it's a little bit strange, and I welcome your feedback on that. What you can see is that the odds of being a non-fatal drowning victim as opposed to fatal are greatly increased at younger ages for both ED visits and hospital admissions. In terms of sex, females are 2.72 times, shouldn't say more likely because it's odds, not relative risk. However, odds ratios are a good approximation of relative risks when it's a rare outcome such as drowning. But so a 2.72 increased odds over males to be a non-fatal drowning victim compared to fatal. In interest of time, I won't spend too much on location right now, but there were significant differences between non-fatal drowning victims and fatal drowning in terms of location, and it warrants some further examination. Not surprisingly, based on the figures I showed earlier, there's significant increased odds for water transport over any other external cause. So I was really keen on reporting some type of ratio after my literature review from 2013. So it's definitely an underestimate because we're missing any non-fatal drowning victims that did not seek medical attention or were not presenting to one of the facilities that were included in this study. And this is only looking at one province, Ontario, because that's the only province where we had all three databases having a complete set. But for that particular province, using this inclusion that I've presented so far, the ratio of fatal to non-fatal drowning would be 1:8. Interestingly, 11% of non-fatal drowning patients who were seen in an emergency department were hospitalized. So this is definitely not as high as what had been reported in the CDC study, but it is still higher than what is typical for unintentional injuries in Canada. So all unintentional injuries, about 6% are usually admitted to hospital, so 11% for non-fatal drowning. As I said, young age was significantly associated with an increased odds of being a non-fatal drowning patient as opposed to a fatal drowning. And although the majority of all drownings, both non-fatal and fatal, are male, there was a greater proportion of females in the non-fatal group than the fatal group. So where about 8 out of 10 drowning victims in Canada, fatal drownings, are male, it was about 65% in the non-fatals. So there was a significant difference in the sex breakdown as well. And these confirm what has been presented in some of the other non-fatal studies. In terms of location, there are some significant differences. It warrants further investigation. External cause, again, the water transports, overwhelmingly the majority, and not surprisingly, the highest odds were associated with water transport incidents. Although it's early on, these are preliminary results that I'm working on, I think that there are certain implications for prevention. In Canada, the nonprofit drowning prevention organizations use the research that they conduct, which has mostly been fatal drowning research, in order to inform their programs, drowning prevention campaigns, that type of thing. So because of that, and because the characteristics of non-fatal drowning significantly differ from fatal drowning, it's important to consider non-fatal drowning as well when designing these initiatives and campaigns. So we want to prevent all drownings, not just the fatal ones, and thus need to expand our focus to non-fatal drowning as well. There are many limitations, and I'm sure as this starts to go through peer review, there'll be many, many more identified. But some deaths may still be under investigation, as is the case anytime you're doing coronial research, because they can take a long time to close after the study period. Estimated ratio may not be nationally representative, because as I said, we only had complete data from all 3 sources for Ontario. And the groups, despite our efforts, may not be exactly mutually exclusive. Because the data had to be de-identified, we couldn't specifically link the databases. So I explained the process of how we removed them from each group, but I can't guarantee that they're mutually exclusive. In conclusion, fatal drowning is just one small part of the drowning problem. We need to be targeting all drownings, including non-fatals. I'd like to thank my PhD supervisor, Dr. Alison McPherson, as well as the agencies that provided the data for the study. And thank you very much to the Scholarship Foundation for supporting my attendance here. And there I am getting my start in drowning prevention, back when we thought water wings were okay. Thank you.